It appears the sixth wave has peaked and can soon be heading in the right direction. And while this is positive news, the Ontario Science Table is warning that there's still a lot of virus burning through the community, and significant pressure on the healthcare system will continue in the weeks ahead.
Government really lifted public health measures too soon when the level of transmission coming out of wave 5 was still too high. We would be in a better place if the mask mandate had continued a little bit longer.
Wastewater signals appear to be showing COVID-19 infections are leveling off in most of the province, with cases plateauing very high at about 100,000 a day. It will take another week or so to confirm the direction we're heading in, but the hope is it's down. Dr. Lauren Cipriano, a member of the Ontario Science Table, tells me, while this is positive, we need to keep this information in perspective.
The infection risk right now is as high as it's ever been.
As high as it's ever been.
The good news is that we might have peaked or we might be plateauing, and we'll be able to confirm that in coming days. But right now, the infection risk is high. And so coming down from high is better than going up from high.
Over the coming weeks, hospitalizations are still expected to rise, but will likely be lower than the fifth wave that put more than 4,000 people in hospital during that peak. Today, the Premier made assurances that the healthcare system can handle what's to come.
I go back to the capacity that we have now compared to the beginning of this pandemic. We have the capacity in the hospitals. We've hired more healthcare workers. We have the antiviral pills. We're doing fairly well as a province.
But the president of the Ontario Hospital Association tweeting out a tough period is still ahead, with so many staff absences due to uncontrolled community spread. Many hospitals in the province are facing significant staff shortages. The Kingston Health Sciences Centre, for example, had to cancel recent surgeries due to staff and patients catching the virus.
There are real costs to running our hospitals at the edge and our healthcare workers ragged.
Okay, so when we keep hearing from the government that we have the capacity.
The on-the-ground experience is that our healthcare workers are working as hard as they've ever worked for us.
Now, the Science Table does say that the Easter long weekend could be a game changer in all of this and potentially refuel the wave. If you are planning to gather with family, the advice is to follow as many public health measures as possible.